So our next discussion, we continue, and this time with the global outlook of COVID-19 in children, which has been on the rise in some countries with a recent 10% increase in the total number of reported child cases. While all children are capable of getting the virus that causes COVID-19, they don't become sick as often as, children have mild symptoms or they have no symptoms. They don't become as sick as often as adults. Well, joining us to talk more about this global view, Dr. Shola Faniro is a developmental pediatrician at Mediclinic City Hospital and clinical associate professor of pediatrics at Mohammed bin Rashid University. She joins us from Dubai. Thank you for joining us on the program.
Thank you for having me.
Now, let's start with the COVID-19 vaccine for children, and this is in the UAE. What is the age range, and have a reasonable number of adults been vaccinated?
Well, starting with the children, we do have approved vaccines for children, and there are two main ones in the UAE. So the Pfizer vaccine is approved from 12 years and above, while the Sinopharm is approved from 3 years and above. And there has been good uptake of that as well. And roughly about a third of children have now been vaccinated with the COVID vaccine. But when we talk about adults, it's really amazing. And it's a good time to be living in the UAE because UAE has the highest uptake of vaccine in the world, with about close to 90% of adult residents having one vaccine and close to 80% already fully vaccinated with at least 2 vaccines.
Staggering figures there. But if we look at the safety of the vaccines, especially the ones approved for children, there seem to be quite a number. And our parents, what do they think about this? Are they open to their children receiving the vaccines?
Well, I guess when we talk about safety concerns for vaccines, it's the same concern that people have had about the adult vaccine, thinking maybe this was rushed, it wasn't well researched. But on the contrary, all these vaccines have gone through rigorous testing. They've been tested a lot, and they've looked at all the potential difficulties that might happen in children. So yeah, it's well tested. Now, any vaccine or foreign body that you put into someone has the potential of risk, but the COVID vaccine up to date doesn't have any more significant difficulty than any of the vaccines that we've had. And I guess, again, because of the way it's been explained to the community, quite a number of parents do ask. And I'd say a significant number of my pre-adolescents from age 12 and above have had the Pfizer vaccine. In particular, any one of them that has any chronic medical problem like asthma or any inflammatory disease. Because unfortunately, as you mentioned earlier on, we are seeing more cases of children having quite significant infection or being sick with COVID, in particular with the Delta strain. So when we had an upsurge of the Delta strain, then we had a corresponding increase in the number of children that have quite serious infection with COVID.
Before those children that have had COVID, have there been cases of long COVID-19?
Long COVID is not as common in children. On the contrary, children tend to get something we call MISC, MIS-C, which stands for multi-system inflammatory syndrome in children. And basically what that means is every single organ in the body is attacked. So quite a number of these children end up in intensive care. But with good treatment, luckily, a lot of them have survived and there has been minimal fatality in children. Long COVID is more in adults, and it is a big problem. And for some of them, it can be quite debilitating. So one of my friends, a nurse who works in the COVID ward in UK, ended up with low heart rate. So her heart rate was dropping down to 30, 40 until she was fainting at work. Some people, they just have prolonged fatigue. So we do have a problem with long COVID, but luckily it's not as bad in children.
Finally, this statement, I think it applies to children and also adults, for example, that children are just as vulnerable as anyone else who has not been vaccinated, but unless they have underlying health conditions, they are less likely to get sick and die from COVID. However, less likely does not mean impossible.
That's exactly right. And that's why not only should we start seriously advocating for children to get vaccinated once the childhood approved vaccines are available in your area, but also to keep taking on all the precautionary measures that has been instigated in your areas, wearing your mask, washing your hands, maintaining social distancing until we know that a large proportion of the community has been vaccinated.
We'd like to thank you, Dr. Shola Faniro, is a developmental pediatrician at Medi Clinic, City Hospital, and Clinical Associate Professor of Pediatrics at Mohammed bin Rashid University in Dubai. Thanks for joining us on the program.
And thanks for having me.